If you suffer from hemorrhoids, the chances are you suffer in silence, but you don't suffer alone. 8 out of every 10 people in the United States will be afflicted by hemorrhoids in their lifetime. In fact, over half the men and women over the age of 50 in this country currently have some form of symptomatic hemorrhoidal disease. It's a topic you rarely bring up among family and friends. Traditional treatment can be painful and intrusive. Patients are even reluctant to discuss hemorrhoids with their physicians. But now there's a treatment for hemorrhoids that's finally worth talking about: the Ultroid Hemorrhoid Management System. The Ultroid procedure is painless, effective, clinically proven in thousands of cases, and represents no disruption in your lifestyle. Most important, Ultroid provides a lasting solution to the problem of hemorrhoidal disease and not just the symptoms. This is the anal rectal canal. Sometimes blood vessels in this area can become sore and swollen. We call these swollen vessels hemorrhoids, and various things can cause them. Human beings' upright posture, for example, constipation, diarrhea, straining at defecation, pregnancy, athletic exertion, hard physical labor, obesity, or even a sedentary lifestyle. All of these behaviors can result in repeated engorgement of tissues. Hemorrhoids are also attributed to the normal aging process, fiber-poor diets, and genetic factors. In relation to the anal canal, some hemorrhoids are located externally and some internally, while others are a mix. External hemorrhoids usually require surgery, but Ultroid has proven highly effective in treating internal and mixed hemorrhoids. Hemorrhoid disease is graded from the least severe, grade 1, to the most severe, grade 4. A grade 1 hemorrhoid is an abnormal prominence of tissue in the anal canal. A grade 2 hemorrhoid is one that slips out of place through the anus with straining, but spontaneously retracts. Hemorrhoids that have moved out of position are prolapsed. They require manual reduction and are categorized as grade 3. Finally, the most severe hemorrhoids, grade 4, are fixed, non-reducible lesions that are permanently prolapsed. Ultroid can effectively treat grade 1, 2, and 3 hemorrhoids and some grade 4 hemorrhoids. Ultroid is not recommended for patients who are pregnant, have pacemakers, or are subject to bleeding disorders, undergoing anticoagulant therapy, suffering from an active local infection, suffering from inflammatory bowel disease, immunosuppressed, or patients who have received an organ transplant placed in a lower abdominal quadrant. Traditionally, all hemorrhoids, internal, external, or mixed, were treated through surgery or by outpatient procedures that were often uncomfortable and disruptive to the patient's lifestyle. The Ultroid Hemorrhoid Management System renders most of those treatments obsolete. The Ultroid process is performed in the comfort of your physician's office. The hemorrhoid is isolated, and next, the hemorrhoid tissue is contacted and treated with a specially engineered probe using a microelectric current. The process is painless. You and your physician can converse at all times if any adjustments are needed. There is no need for anesthesia, no surgery, no prolonged expensive hospital visit. Some cases may need repeated treatments, but in most instances, a few follow-up treatments are all that are required. Ultroid is not recommended for patients who are pregnant, have pacemakers, or are subject to bleeding